Hello, everyone, and welcome back to the Science of Ageless Living, the podcast where we dive deep into the cutting-edge science that's rewriting the rules of aging. I'm your host, Dr. Ethan Hausman Marquis, a biohacker, doctor, and researcher, passionate about helping you live not just longer, but better, with more energy, sharper minds, and resilient bodies. Today, we're exploring a fascinating peptide that's generating buzz in the anti-aging community. SS-31, also known as Peptide. This little molecule is like a superhero for your mitochondria, those powerhouses inside your cells that keep everything running smoothly. If you've ever felt that mid-afternoon slump getting worse with age, or noticed your workouts aren't as effective as they used to be, mitochondrial dysfunction might be the culprit. SS-31 promises to target that directly, potentially reversing some hallmarks of aging. Over the next 30 minutes or so, we'll break this down into chapters. We'll cover what SS-31 is, how it works, the animal studies that blew researchers away, human clinical trials including the latest 2025 updates, its benefits for ageless living, safety considerations, and where this peptide might take us in the future. Before we jump in, a quick disclaimer: I'm not prescribing anything here. This is for educational purposes only. Always consult your doctor before trying new supplements or therapies. All right, let's get started. Good morning, or afternoon, or whenever you're tuning in, folks. Let's set the stage. Aging isn't just about wrinkles or gray hair. It's a complex process involving cellular decline, and at the heart of it, pun intended, are our mitochondria. These organelles produce ATP, the energy currency of life. But as we age, they start misfiring, leaking reactive oxygen species that damage cells and accelerate aging. This leakage contributes to inflammation, DNA damage, and a host of age-related diseases like heart failure, neurodegeneration, and muscle weakness. Enter SS-31, a synthetic tetrapeptide developed by scientists like Dr. Hazel Seto at Weill Cornell Medical College. Its chemical name is DRDMT-lisfan-H2, but don't worry, we won't quiz you on that. It's also called Peptide or Bendavia in clinical settings, and it's being developed by Stealth Biotherapeutics. What makes SS-31 special? It's designed to sneak into cells and zero in on mitochondria, fixing problems at the source. Unlike broad-spectrum antioxidants that float around the cell ineffectively, SS-31 homes in on the inner mitochondrial membrane where the action happens. Imagine your mitochondria as tiny factories churning out energy. In youth, they're efficient, converting nutrients into ATP with minimal waste. But with age, environmental stressors, or genetic factors, the machinery rusts due to oxidative stress. SS-31 acts like a targeted lubricant, binding to a key phospholipid called cardiolipin in the inner mitochondrial membrane. Cardiolipin is crucial for maintaining the structure of mitochondrial cristae, those intricate folds where the electron transport chain ETC resides, and for assembling the protein complexes that generate ATP. But why SS-31 specifically? Traditional antioxidants like vitamin C or E are great for general health, but they don't specifically target mitochondria, where up to 90% of cellular ROS is produced. SS-31 does, accumulating there at concentrations up to 1,000 times higher than in the rest of the cell. It's amphipathic, meaning it has both water-loving, hydrophilic, and fat-loving hydrophobic parts, which helps it cross cell membranes easily. The positive charges from the arginine and lysine residues pull it toward the negatively charged mitochondrial interior, while the hydrophobic phenylalanine and dimethyltyrosine stabilize it against oxidation and enhance its binding affinity. In essence, SS-31 isn't just an antioxidant, it's a mitochondrial optimizer. It reduces ROS production at the source, boosts energy output, and prevents cell death pathways that kick in during stress. We'll dive deeper into the mechanics in the next chapter, but first, let's think about why this matters for ageless living. As we hit our 40 seconds, 50 seconds, and beyond, mitochondrial function drops precipitously, linking to everything from chronic fatigue and sarcopenia muscle loss to cardiovascular disease and cognitive decline. If SS-31 can reverse that, it could be a game changer in extending health span, the years we live vibrantly, not just survive. Studies show that in aged animals, SS-31 restores mitochondrial function, improving physical performance and even cognitive abilities. For humans, it's in trials for conditions like heart failure, mitochondrial myopathies, and age-related macular degeneration, and as of 2025, it has even received FDA approval for a rare mitochondrial disorder called Barth syndrome. Exciting, right? But let's not get ahead. Science is about evidence, so stick with me as we unpack this step by step. Let me share a quick analogy to make this relatable. Think of your body as a city, with mitochondria as power plants. When they're functioning well, the lights stay on, traffic flows, and everything thrives. But when they falter, blackouts occur, leading to chaos. SS-31 is like an elite maintenance crew that fixes the generators without shutting down the whole grid. This targeted approach is why it's so promising. Moreover, SS-31's development story is inspiring. It started from basic research on opioid peptides and evolved into a mitochondria-specific therapy. Dr. Seto's team discovered that certain peptides could penetrate cells and protect against ischemia-reperfusion injury, a common issue in heart attacks and strokes. From there, it ballooned into applications for aging and chronic diseases. For those of you interested in the biochemistry, SS-31's structure includes D-amino acids, which make it resistant to proteolysis, extending its half-life in the body. This stability is key for therapeutic use, allowing it to be administered via injection or potentially other routes in the future. As we wrap this intro, remember, ageless living is about optimizing what we have. SS-31 represents a shift from treating symptoms to addressing root causes at the cellular level. If you're already hooked, great. Up next, the nitty-gritty of how SS-31 works its magic. All right, listeners, buckle up. This is where we get into the science weeds, but I'll keep it accessible and engaging. Knowledge is power in the fight against aging, so let's empower you with the details. So, how does SS-31 actually work? Let's break it down layer by layer. At its core, SS-31 targets cardiolipin, that special lipid making up about 20% of the inner mitochondrial membrane. Cardiolipin isn't just a structural component, it's functional and dynamic. It helps form supercomplexes of the electron transport chain, ETC, specifically complexes I, third, IV, and sometimes V, ensuring electrons flow efficiently from NADH and FADH to oxygen, producing ATP without leaking as harmful ROS. This efficiency is what keeps our cells energized and protected. As we age or face stressors like ischemia, toxins, or metabolic disorders, cardiolipin gets peroxidized, meaning it's oxidized by ROS, altering its structure. This peroxidation disrupts the ETC supercomplexes, flattens the cristae folds, increases proton leaks across the membrane, and ramps up ROS production in a vicious cycle. Energy production tanks, while inflammation, oxidative damage, and cell death rise. SS-31 binds reversibly to cardiolipin via electrostatic and hydrophobic interactions, stabilizing its structure and preventing peroxidation. This restores cristae curvature, optimizes ETC assembly, and reduces ROS leakage dramatically. Think of it like this. Imagine the ETC as a conveyor belt in a factory. Peroxidized cardiolipin makes the belt wobbly and inefficient, spilling electrons that ignite fires ROS. SS-31 steadies the belt, tightens the bolts, and improves throughput, leading to more ATP and fewer fires. Preclinical studies demonstrate that SS-31 enhances mitochondrial respiration rates, boosts ATP synthesis by up to 30-50% in stressed cells, and lowers pathogenic ROS levels without affecting beneficial signaling ROS. But there's more to the story. SS-31 also modulates the mitochondrial permeability transition pore, MPTP, a large channel that opens under conditions of calcium overload or oxidative stress, leading to mitochondrial swelling, rupture of the outer membrane, and release of cytochrome C, which triggers apoptosis programmed cell death. By inhibiting MPTP opening, SS-31 prevents this deadly cascade, protecting cells during acute events like heart attacks, strokes, or even chemotherapy-induced damage. Another key player is cytochrome C itself. Normally, cytochrome C shuttles electrons between complexes 3 and IV in the ETC. However, when cardiolipin is peroxidized, it interacts with cytochrome C, flipping it from an electron carrier to a peroxidase enzyme that amplifies lipid peroxidation. SS-31 breaks this cycle by keeping cardiolipin intact, ensuring cytochrome C stays in its beneficial role. Diving deeper into the biophysics, SS-31's positive charges interact with cardiolipin's negatively charged head groups, altering local membrane potentials and curvature to favor optimal protein assembly and dynamics. This leads to improved mitochondrial fusion and fission processes, which are essential for quality control, allowing damaged mitochondria to be segregated and recycled via mitophagy, the cellular cleanup system. Now, let's tie this mechanism directly to aging. Mitochondrial dysfunction is one of the 9 hallmarks of aging, as outlined by Lopez-Otin and colleagues in their seminal 2013 paper. The free radical theory of aging posits that accumulating ROS damage mtDNA, proteins, and lipids, creating a feedback loop of decline. SS-31 interrupts this by acting as a mild antioxidant itself, scavenging ROS directly, and more importantly, by fixing the source of the problem, inefficient electron transport. In isolated mitochondria from old cells, SS-31 restores membrane potential, deltazyme, reduces proton leak, and normalizes respiration rates to youthful levels. For example, in cardiomyocytes, heart muscle cells from aged mice, SS-31 treatment significantly cuts superoxide and hydrogen peroxide levels, partially restoring the respiratory control ratio, a measure of mitochondrial efficiency. It also decreases protein oxidation markers like S-glutathione and carbonylation, which impair enzyme function, and even reduces cellular senescence, those zombie cells that stop dividing but spew inflammatory signals, accelerating tissue aging. An intriguing aspect is sex differences in response. In long-term studies with aged mice, SS-31 boosts physical strength and endurance more in males, while females see greater improvements in cognitive performance and metabolic health. This highlights the need for personalized medicine and anti-aging therapies, considering hormonal and genetic variations. Mechanistically, SS-31 isn't magic, it's precise bioengineering. Its plasma half-life is about 4 hours in animals, and it readily crosses the blood-brain barrier, opening doors for neurological applications. Typical doses in preclinical models range from 0.01 to 0.25 milligrams per kilogram intravenously, but human trials have used up to 40 milligrams subcutaneously daily. Researchers are exploring oral formulations to make it more accessible. To illustrate, consider a study where SS-31 was added to cultured cells exposed to hydrogen peroxide, a common ROS. Treated cells showed 70% less damage, preserved ATP levels, and reduced activation of pro-apoptotic pathways like caspase-3. This cellular resilience translates to organ-level protection, as we'll see in animal studies. Whew, that's the mechanism unpacked in detail. If your head's spinning a bit, that's okay. Grab a coffee or tea, and let's move on. Next, we look at preclinical evidence, where SS-31 truly shines in animal models of aging and disease. Chapter 3, From Lab to Life, Preclinical Studies on SS-31. Welcome back, ageless warriors. Now that we understand how SS-31 works at the molecular level, let's see it in action through preclinical studies. These are primarily animal models, mice, rats, dogs, and even some pigs, designed to mimic human diseases and the aging process. The results are impressive, consistently showing SS-31's potential to reverse age-related declines across multiple organ systems. I'll walk you through the key findings, grouping them by organ or condition for clarity. Starting with cardiovascular health, which is a major concern as we age, heart disease is the leading cause of death worldwide. In a dog model of advanced heart failure induced by microembolization, chronic SS-31 treatment, 3 mg daily for 3 months, significantly improved left ventricular function. It reduced end systolic volume by 25%, boosted ejection fraction from 30% to 45%, increased stroke volume and cardiac output, and normalized hemodynamic parameters. Biochemically, it reversed mitochondrial dysfunction by enhancing ATP synthesis rates, cutting ROS production, and restoring electron transport chain activity. It also normalized circulating biomarkers like brain natriuretic peptide, BNP, and pro-inflammatory cytokines, while reducing cardiac hypertrophy and fibrosis, the scarring that stiffens the heart. In age mice, 24 to 28 months old, equivalent to humans in their 70s, 80s, an 8-week course of SS-31 reversed age-related diastolic dysfunction, a common precursor to heart failure with preserved ejection fraction, HFpEF. Echocardiography showed improved EAH-A ratio, a measure of ventricular relaxation, and decreased myocardial performance index. Remarkably, these benefits persisted for weeks after treatment cessation, suggesting SS-31 induces lasting remodeling. At the cellular level, it normalized proton leak, lowered H2O2 emission, and restored mitochondrial membrane potential in isolated cardiomyocytes. Proteomic analysis revealed reversal of age-associated changes in over 100 proteins, particularly in mitochondrial energy pathways, and it decreased senescence markers like P16INK4A and P21. Moving to skeletal muscle and sarcopenia, the loss of muscle mass and strength that makes everyday activities harder with age. In aged mice, SS-31 treatment improved mitochondrial bioenergetics in skeletal muscle, increasing fatigue resistance and shifting fiber types toward more oxidative, endurance-capable ones. A long-term study treated 18-month-old mice with SS-31 for 10 months. Males showed enhanced grip strength, rotor-rod performance, balance and coordination, and treadmill endurance, while females exhibited better spatial navigation in maze tests and maintained lean body mass despite aging. On a high-fat diet, SS-31 prevented excessive fat accumulation and insulin resistance, suggesting metabolic benefits beyond muscles. Kidney health is another area where mitochondria play a starring role as renal cells are energy hungry. In rat models of ischemia reperfusion injury, simulating acute kidney injury, SS-31 administered before or after insult-reduced tubular damage, inflammation, and apoptosis, while improving mitochondrial cristae integrity and accelerating ATP recovery. In diabetic nephropathy models, streptozotocin-induced diabetes in mice, chronic SS-31 protected glomerular structure, restored podocyte function, reduced albuminuria, and attenuated fibrosis via reduced TGF-V signaling. Interestingly, even a short 4-week course led to persistent remodeling with improved glomerular filtration rate, GFR, months later. For neurodegeneration, where mitochondrial dysfunction underlies Alzheimer's, Parkinson's, and more, SS-31 shows neuroprotective effects. In Alzheimer's mouse models, APP, PS1 transgenics, and neuronal cells exposed to amyloid beta, SS-31 recovered mitochondrial function, increased synaptic density, boosted neurite outgrowth, and upregulated biogenesis factors like PGC1A. In Parkinson's models using MPTP toxin, it dose-dependently protected dopaminergic neurons in the substantia nigra from oxidative damage and preserved motor function. Mechanisms include enhanced BDNF signaling for neuronal survival, promotion of mitochondrial fusion via MFN2, and reduction of neuroinflammation by inhibiting NLRP3 inflammasome activation. SS-31's versatility extends to other conditions. In atherosclerosis-prone ApoE knockout mice, it reduced plaque size, oxidative stress, and endothelial dysfunction. For osteoarthritis in ex vivo cartilage explants, it preserved chondrocyte viability under inflammatory stress. In type 2 diabetes models, it prevented beta cell apoptosis in the pancreas and improved insulin secretion. Even in ocular models like glaucoma, it protected retinal ganglion cells, and in pulmonary hypertension, it ameliorated vascular remodeling. One practical application is mitigating chemotherapy side effects. With doxorubicin, a common cancer drug that causes cardiotoxicity, SS-31 co-treatment in rats and mice preserved cardiac function, reduced ROS bursts, and attenuated apoptosis without interfering with the drug's anti-tumor efficacy. A standout long-term study in mice demonstrated SS-31's role in healthy aging. It enhanced overall phenotypes in a sex-dependent manner, improving cardiac diastolic function in both sexes, but prioritizing physical performance in males and cognitive metabolic health in females. It also mitigated the deleterious effects of a high-fat diet, hinting at potential for obesity and metabolic syndrome prevention. Collectively, these preclinical studies paint SS-31 as a broad-spectrum mitochondrial protector, effective against the multifaceted nature of aging. The consistency across species and models bodes well for translation to humans. But remember, animals aren't humans. Differences in metabolism and lifespan mean we need clinical data. Next up, human trials, including the groundbreaking 2025 developments. Now, the moment of truth for any therapy, human clinical trials, SS-31 or Peptide, has progressed through phases 1-3 for various indications with mixed but increasingly encouraging results, especially with the 2025 FDA approval. Let's break it down by phase and condition, highlighting both successes and challenges. First, on safety, across over 20 trials involving hundreds of participants, Peptide is well tolerated. Phase 1 studies in healthy volunteers established doses up to 0.25 mg/kg, IVICs, or 40 mg SC daily, with mild transient side effects like injection site reactions, pain, redness, headaches, dizziness, and nausea. No serious adverse events related to cardiac conduction, ECG changes, liver, kidney function, or immunogenicity were reported, even in long-term extensions up to 168 weeks. In cardiovascular trials, the Embrace STEMI phase 2A study in ST elevation myocardial infarction, STEMI, patients post-PCI didn't meet the primary endpoint of reducing infarct size by MRI, but post-hoc analysis showed lower incidence of new heart failure at 6 months. The Progress-HF Phase 2 trial in heart failure with reduced ejection fraction, HFrEF, missed the primary left ventricular end systolic volume reduction, but improved mitochondrial function in blood cells, exercise capacity, 6-minute walk test, and quality of life scores. A smaller open-label trial in elderly HFpEF patients showed significant ventricular volume reductions and symptom relief after 4 weeks. For rare mitochondrial diseases, where SS-31's targeting shines, the TAS-Power Phase 2-3 trial in Barth syndrome, a genetic disorder causing cardiomyopathy and muscle weakness, was pivotal. Daily 40 mg/SC for 12 weeks improved muscle strength, cardiac stroke volume, and lipid profiles. The 168-week open-label extension sustained gains in 6-minute walk test, 6MWT, reduced fatigue, and normalized cardiolipin ratios in blood. This led to the landmark FDA accelerated approval in September 2025 for Forzinity Peptide as the first treatment for Barth syndrome based on surrogate endpoints like cardiolipin improvement. In primary mitochondrial myopathy, PMM, the mEMPOWER-3 Phase 3 trial failed the primary 6MWT endpoint but significantly reduced fatigue via PROMIS scale and improved daily activities. Post-hoc subgroup analysis showed benefits in patients with specific mtDNA mutations, prompting the ongoing New Power trial for refined enrollment. For eye health, the RECLAIM Phase 2 trial in dry age-related macular degeneration, AMD, missed primary visual acuity endpoints, but slowed progression of ellipsoid zone attenuation, a biomarker for photoreceptor loss, preserving retinal structure over 24 weeks. A phase 3 is underway as of 2025. Kidney trials include a phase 2A in atherosclerotic renal artery stenosis, where single-dose IV elamipretide improved renal blood flow, reduced cortical hypoxia, and boosted GFR by 20-30%. In renovascular hypertension post-stenting, it enhanced microvascular function and reduced inflammation. Directly for aging, a small phase 1 trial in healthy older adults, 65 plus, showed a single IV dose increased skeletal muscle mitochondrial energetic capacity by 30%, measured via 31p MRS spectroscopy. No large-scale anti-aging trials yet, but extrapolations from disease studies suggest potential for frailty and multi-morbidity. Challenges in trials include some missed endpoints, possibly due to short treatment durations, often for 12 weeks, heterogeneous patient populations, or insensitive outcome measures. Genotype-specific responses, e.g., better in nuclear versus mtDNA defects, underscore the need for precision medicine. Bioavailability via SC injection is good, but IV was used in early trials for acute settings. Overall, with the 2025 BARTH approval marking a milestone, elamipretide shows promise for mitochondrial disorders, with ongoing planned trials in AMD, PMM, cardiomyopathy, and potentially broader indications like Friedreich's ataxia. This paves the way for off-label exploration in aging, though regulatory hurdles remain. So, how does SS-31 fit into the broader picture of ageless living? By directly targeting mitochondrial dysfunction, it addresses multiple hallmarks of aging simultaneously, from genomic instability via reduced mtDNA damage and telomere attrition indirectly through less oxidative stress, to epigenetic alterations, loss of proteostasis, deregulated nutrient sensing, e.g. AMPK activation, cellular senescence, stem cell exhaustion, and altered intercellular communication via reduced inflammaging. Potential benefits for everyday ageless living are profound. Enhanced mitochondrial function means more ATP, translating to reduced chronic fatigue, improved endurance, and better recovery from exercise. Imagine tackling that hike or gym session with the vigor of your younger self. For heart health, it could prevent age-related stiffness, diastolic dysfunction, and progression to heart failure, potentially adding years of active life. In the brain, neuroprotective effects suggest delays in cognitive decline. By reducing neuroinflammation and promoting biogenesis, it might ward off Alzheimer's and Parkinson's symptoms, improving memory, focus, and mood. Vision-wise, slowing AMD progression could preserve independence in reading, driving, and daily tasks. For kidneys and metabolism, protection from diabetic complications and obesity-related damage supports overall vitality. Sex-specific benefits add nuance. Women might see greater cognitive and weight management gains, while men benefit more from strength and physical performance improvements. Integrating SS-31 with lifestyle interventions like intermittent fasting, resistance training, or polyphenol-rich diets could amplify effects, as these also boost mitochondrial health. In a holistic, ageless living plan, SS-31 could be a cornerstone for those with mitochondrial vulnerabilities, but it's not a silver bullet. Combine it with sleep optimization, stress management, and community engagement for maximal impact. Safety is paramount in any therapy, especially for long-term use in aging. Elamipretide's profile is strong. In clinical trials, adverse events are mostly mild and transient, with injection site reactions affecting 20-30% of participants, resolving quickly. Other common ones include headache, 10%, dizziness, 5%, and gastrointestinal upset, nausea, 8%. No evidence of accumulation or tachyphylaxis in long-term use, and no drug interactions reported with common meds like statins or antihypertensives. However, potential risks exist. In one preclinical cancer model, SS-31 exacerbated DNA damage in irradiated cells, suggesting caution for those with active cancer or history. though it protected healthy tissues in chemo models. Allergic reactions are rare but possible. For pregnant or breastfeeding individuals, data is lacking, so avoid. Monitoring for kidney function is advised in renal patients, though trials showed benefits. Access post-2025 approval. For Barth syndrome, it's available. For others, via clinical trials or expanded access programs. Cost and insurance coverage are evolving. Always consult a specialist. This isn't DIY territory. Looking to the future, SS-31's trajectory is bright. With Barth approval in 2025, expect expansions to other mitochondrial diseases like PMM and Friedreich's ataxia, plus common age-related conditions like HFpEF, AMD, and even long COVID mitochondrial sequelae. Researchers are optimizing dosing, exploring oral or topical formulations. Early tests show promise, and combining with other therapies like NAD plus boosters or senolytics. Ongoing trials, as of late 2025, include new power for PMM, a phase 3 for dry AMD, and exploratory studies in neurodegenerative diseases. Global access via Stealth Biotherapeutics pipeline could make it a staple in anti-aging medicine. Alternatives like MitoQ or SKQ1 offer similar targeting but less clinical data. SS-31's FDA milestone sets it apart. We've covered a lot today, from the basics of SS-31 to its mechanisms, studies, trials, benefits, safety, and future. This peptide offers real hope for mitochondrial-targeted anti-aging, potentially transforming how we approach vitality. Key takeaway: mitochondria are key to ageless living. Nurture them. Stay curious. Experiment safely. And prioritize evidence-based strategies. If SS-31 intrigues you, discuss with your doctor, especially with the new 2025 approvals. Thanks for listening to the Science of Ageless Living. Subscribe, leave a review, and join us next time for more on longevity science. I'm Dr. Ethan Hausman Marquis. Here's to age less vitality.